So it just comes to me right then. I have the realization that I'm in the United States of America, a level 1 trauma center, and I am literally standing in front of someone who is getting eaten alive by bugs. So in this very first video, in this new series of videos that I'm doing, I want to talk to you about two patients. They were seen 15 years apart and had completely different disease processes that brought them to the hospital. But not only do they highlight some of the failures in our healthcare system, the fact that the same breakdowns happened 15 years apart really highlight how little the problems within our healthcare system have changed during this 15-year span. The first patient I want to tell you about is an elderly lady that I encountered back in 2009. This was when I was an intern and I was fresh out of medical school. She literally is one of the first few patients I ever encountered. And her chief complaint was, I need help with my magnets. So to put that into context, when somebody came into the emergency department where I was working at that time, you were separated into the P side and the G side. The P side was where our higher acuity patients went, patients that were suffering from heart attack, stroke, multi-system trauma. The G side was where our lower acuity patients went, maybe minor fractures, colds, some non-specific abdominal pains. Pretty much everything that wasn't triaged high acuity was sent to the G side. And because of that, you really didn't know what you were going to get when you went into the room. All I had to go by was the chief complaint that was listed within the healthcare system. It literally said, I need help with my magnets. The worst thing that I could think of that I was actually going to see when I went in there was somebody who potentially had swallowed some magnets. Obviously in the emergency department we see swallowed foreign bodies all the time. But I walk into the room and I pull back the curtain and I see this frail lady lying in the bed. She's elderly, she's deconditioned. You can clearly tell she hasn't been cared for appropriately in a long time. And in somewhat incomprehensible speech, she again says, I need help with my magnets. It's at that time she grabs the hospital gown and pulls it down, and I look down and she has this large fungating breast mass that takes up probably 40% of her chest wall. And as I look closely, I see tons of maggots just covering the wound. And I look at this lady in this level 1 trauma center in the United States of America, and I come to the realization that this woman in front of me is being eaten alive by bugs. Overall, hemodynamically wise, she was relatively stable from a vital sign standpoint. From her muffled speech, I could gather that she lived by herself and didn't have any friends or family that would check on her regularly. At that point in my career, I clearly had never seen anything like this before, so of course I go back to my attending, starting the sentence off with, you are not going to believe what I just saw. But this attending, who had been practicing for decades, had mind-blowingly already seen cases like this several times in his career. He looked at me and says, well, the maggots are only eating dead tissue. And it was crazy for me to think at that time that it was these magnets that were actually keeping her alive. Seeing somebody with a large fungating breast mass that is eroded through her chest wall and is riddled with maggots definitely falls into the things you can't unsee category in your brain. This patient would die a few weeks later in the hospital, ultimately from other medical problems that had gone undiagnosed for God knows how long. It was one of my first direct patient care experiences that really illustrated how so many people fell through the cracks in the healthcare system that was in place in 2009. So let's fast forward to 2023. A couple of months ago, I walk into the room of a middle-aged patient. The chief complaint was unilateral weakness for 1 week. Generally, unilateral weakness in the emergency department is a stroke until ruled out. But this patient's symptoms have been ongoing for about a week, and with the help of public service announcements and how ubiquitous cerebrovascular disease in the country, most people are pretty aware that unilateral weakness can be a stroke and they need to go immediately to the hospital. So with symptoms ongoing for about a week in this otherwise previously healthy patient, I figured something else was probably going on. So I walk into the room, I talk to this patient. She has no medical problems. She takes no medicines on a regular basis. She has no primary care physician, and she states for about 7 days she's had trouble with her speech and is markedly weak on her left side. Her dysarthria is actually so severe I'm having trouble understanding her, but I can make out that prior to the symptom onset, other than being a smoker, which really is the problem here for this particular patient, she had no prior medical problems. She was employed, living a normal life. So among other things, the patient clearly needs a CT scan, which was ordered. The results of the CT ultimately did show that about a week ago, basically when her symptoms started, she did suffer a stroke. Now the thing about stroke, and the reason pretty much everybody knows that when you have unilateral weakness or if you're concerned about a stroke, you need to get to a hospital as soon as possible, is it becomes decreasingly possible that we will be able to successfully treat that stroke with increasing time passed since the onset of symptoms. Basically for this patient, a week had passed since her symptoms began, and for all intents and purposes, there's nothing that can be done. She would come into the hospital, a few more tests would be ordered, but ultimately she's going to be discharged with blood pressure medicines, cholesterol medicines, daily aspirins, basically a regimen of medications to decrease the likelihood she'll suffer a stroke in the future. I was so taken aback by how this patient, who seemed incredibly normal, would let a week go by without coming to the hospital with such severe symptoms. And I sat there and asked her, she could barely talk. And she said it was because she didn't have health insurance and she was afraid of the medical bills. And as soon as she said that, I thought about that fungating mass patient and how so little little has changed for so many people in America. Unfortunately, if you look at the data, one of the leading causes of bankruptcy are medical bills. So I know two things for sure. Very little has changed for a lot of people. And number two is I truly have no idea what an all-encompassing solution for everyone involved is. But I really hope we come up with it soon. Okay, this is the first in a series of healthcare videos that I'll be doing. They all won't be this depressing or policy-based. If you enjoy it, let me know in the comments. If you have thoughts about our healthcare system, let me know in the comments. And I'll see you soon.